My name is Dan Garcia, and I'm the program manager of the Master of Science Anesthesia program. And I have the pleasure today of serving as your Master of Ceremonies. So I will invite folks to the podium. I will help keep the program going and make sure we all have a great time. All right? So without further ado, I'm very pleased to introduce the Provost and Executive Vice President of the Medical College of Wisconsin and the Julia A. Uline, M.A., Dean of the School of Medicine, Dr. Joseph Kirschner. Dr. Kirschner, please come up to the podium.
Well, I'm happy to be here this afternoon. This is a learning environment, so it's Eline.
Thank you.
I only have to point it out because Ms. Eline gave us a very large gift to have that named, and she'd probably be mad if I didn't correct the pronunciation of her name. And, so that's one of the things I do. But I want to welcome you all here. It's my pleasure to really acknowledge the growth and development of this program. I know you all have been working here since August. So it's not like this is really your first thing that you've done, but this is a program that I personally believe is so special. We've started with about 12 students and we're up to 18 now. It's been a place that's been invested in by the Medical College of Wisconsin, the School of Medicine, but in particular the Department of Anesthesia. And as we were sort of thinking about this as a program here at the Medical College of Wisconsin and having those conversations, as somebody who's a surgeon, so I'm a pediatric ear, nose, and throat surgeon, and I have had the pleasure throughout my career, really almost all of my career, working with individuals who have done your training program at Children's Hospital. So I'm in the OR with individuals, obviously anesthesiologists as well, but people that have their Masters of Science in Anesthesia. And it just always was so incredibly grateful for the skill and all of the things that were brought to that operating room, helping me to take care of my patients. And so I think it was a natural for us to add this here at the Medical College of Wisconsin, but I will say that it has been even more wildly successful than even I imagined. The success of the students, not only having job placements, I guess at the end of the day, that's an important thing, right? We all want to have a job when we're done, but just even in the academic achievement of the students and just your leadership teams, there's a ton of credit for all of that work. I understand that we've really had an emphasis towards really looking at the overall diversity of the class, and that this is a very diverse class. And I think that's important because the Medical College of Wisconsin is really, as an anchor institution, has put our flag in trying to help move our school, our health science university, our community, our state, our world along in diversity and inclusion. And it's a lot of effort, but it's well worthwhile and something that we certainly need to put additional effort in. So I want to just welcome you. If there's anything that I can do for you as you're matriculating along through your education program, Jay Kirschner at mcw.edu. My cell phone number is 414-510-8940. I actually do give that out to all the students when I see them for a first time. It's interesting. I'm not sure anybody's ever actually taken me up on that from a call or a text perspective, but I do get a lot of emails from students, and so if you don't remember it, I'm sure Michael can give you my email address if you need to. Go to him first though, before. No, I'm kidding. But I believe that MCW is a family atmosphere. I think I write about that a lot. I've been here forever. If you don't know, I went to medical school here. So actually my connection with the Medical College of Wisconsin started when I was a first year undergraduate at University of Wisconsin-Milwaukee. So in 1983. So I have one of the longest connections of anybody that's alive with MCW. I know. What's your year? 84. So, all right. You beat me by a couple of years, but I really do. I mean, I really do care about this institution a lot. And so I I know your leaders also provide that access to you, and I'm grateful for that. But I want you to feel welcome here, and know that there's a group of folks that really care about your success and want you to reach out if you need us. So I don't know. With that, those were my remarks, and I'll turn it back over. And looking forward to watching you get the white coats.
Thank you, Dr. Kirschner. I now welcome Dr. Michael Stout, MSA Program Director, to the podium.
Good afternoon, everyone. It is absolutely my honor to welcome you. Thank you, Dr. Kirschner, for being here. Dr. Lang, hello to everyone that's viewing us at home. We wish you were here in the seats, but we're glad you're here one way or the other. Class of 2023, and then we also have our senior students here as well, faculty and staff. What a great opportunity for us to come together. And you are going to be immersed, you already are, in the science and the practice of anesthesia. It's exciting, it's overwhelming, it's daunting. But here's a chance for us to remember our role as caregivers. CAs don't wear white coats often, but it's so important that we meet here today to remember that this is not just a career in anesthesia, but it's a life lived in the service of others. We've got a long list of distinguished people that are going to talk to you about the tenets of our field, such as vigilance, what the white coat means, what it means to be a healthcare provider. As you hear their words, I want you to remember, some have described these kinds of educational opportunities from the perspective from cradle to grave. Think about how many years you put into getting to where you are today, even if you did not know your destination. Every step, every effort, every failure, every success got you to where you are today. You're going to spend a very brief time with us. Careers are measured in decades. As those decades move on, you're going to touch thousands. And every student you mentor is going to touch thousands. When you work with them, always remember what you learned today about how you're a caregiver first and an anesthesia provider. So, without further ado, thank you very much. I look forward to hearing our speakers. Dan, thank you. And we can introduce Dr. Lang.
Thank you, Dr. Stout. I would now like to introduce the president of the MCW Marquette Medical Alumni Association, Dr. George Lang.
Welcome, welcome, welcome. I'm so happy to be here today and honored to be here for this white coat ceremony. On behalf of the MCW Marquette Medical Alumni Association, I want to welcome you to the Medical College of Wisconsin. I am George Lang, as mentioned, and I graduated from MCW in 1975. And I have remained connected to MCW alumni, students, and faculty in a variety of roles. And this lifetime engagement has truly enhanced my time as a physician and as a person. I appreciate the opportunity to be part of this momentous day in your medical education and in your life. Traditionally, the white coat ceremony marks the beginning of your journey into the healthcare profession. Reflections of the past couple of years as we have navigated our way through the greatest public health threat of our lifetime highlight this milestone for you. Thank you for your decision to dedicate yourselves to healthcare. As you move toward the experience will shape your generation of providers. My experience at MCW prepared me tremendously for my work and I have every confidence that you will receive equally positive experience and education. I hope you have all registered on Engage, our online alumni platform, where you can reach out to alumni and build your professional network and be mentoring opportunities and maybe employment opportunities. Just go to mcwengage.com. At the core of MCW's mission is educating and training skilled doctors, scientists, pharmacists, and healthcare professionals such as yourselves, who are prepared to meet the ever-changing needs of the communities they serve. And the Alumni Association is another vital campus partner that is here for you. Congratulations again.
Thank you so much, Dr. Lang. We are going to now hear from Dr. Cynthia Lean, Chair of the Department of Anesthesiology, via a pre-recorded message.
Good afternoon. I'm so sorry that I can't be with you this afternoon to celebrate this really momentous occasion. I am thrilled that you're able to have the white coat ceremony in person, but schedules being what they are, unfortunately, I can't be with you. I did want to take this opportunity, though, to congratulate each of you on starting a 28-month journey during which you're going to become an integral member of the anesthesia care team. As you will hear from Dr. Connolly, the white coat ceremony is a relatively new tradition that marks this major step that you're taking as you begin the training for your career choice. As students and as graduates, you will be granted a privilege that relatively few people have, that of caring for patients and all that that entails. As part of the Department of Anesthesiology, I can promise you that your education, both in the classroom and in the clinical setting, will be second to none. With your scheduled teaching sessions, your continued hard work, and your involvement in patient care over these next 28 months, you will graduate well prepared to provide patient care in any setting you choose, whether a small community hospital or a large academic medical center. You were selected from hundreds of applicants because of your interest and your capacity to function as members of a care team, and your willingness to work hard and do best for your patients. I have repeatedly been impressed by the professionalism of the MSA students and the CAA faculty. Remember, as you are learning to care for the sick, the technical skills are really just a small part of what it is that we do, and that our patients will probably better remember the power of our warmth and caring for them, our understanding of the challenges that they're facing, and our ability to reassure them than they will any of the science that went into the decisions in caring for them. In addition to becoming part of the MSA program with its outstanding leadership and faculty, you are now a member of the Department of Anesthesiology, and it is our mission as a department to consistently provide outstanding patient-centric care. Caring for the sick is an honorable profession, and it's a demanding profession, and I can almost guarantee you that it is not always easy. But remember, as I said earlier, it's a privilege to care for the sick. A privilege that very few people in society actually have, and in order to provide outstanding care, keep that privilege in perspective and consistently learn from your patients and colleagues, and with everyone with whom we work and everyone with whom you interact. And remember, with privilege comes real responsibility to the systems in which you work and the patients you serve. You will serve your patients well if you always advocate for them and keep their best interests in mind, and if you remain a lifelong learner. Doing all of these will allow you to become the professional you entered this program to become, and ultimately will bring you immeasurable personal and professional satisfaction. So with that, and on behalf of the entire Department of Anesthesiology, welcome to the department. We are excited that you are here and look forward to working with you. Thank you.
Thank you so much, Dr. Lean, for those gracious words. It is now my pleasure to introduce to you the MSA Program Medical Director, Dr. Lois Connolly, to speak on the symbolism of the white coat.
Hey, good afternoon. Welcome. the class of 2023, and I see some 2022s here. Unfortunately, because of COVID, we were not able to hold a white coat ceremony last year, so I'm really happy to see you here. I am talking about the history of the white coat ceremony and the symbolism behind some of the white coats. And I found two pictures which I'm sure you probably recognize. On the right-hand side is a picture of that's in the Ether Dome. This is one of at the Massachusetts General Hospital, and this is a surgery that's being taken place. And what you see actually is physicians all gathered around this patient, and they're dressed in black. You might be surprised to hear that in the late 19th century, that physicians dressed themselves in black. And black attire was really considered formal, and medical encounters were considered very serious and formal encounters. There's really a solemn nature to their role at that time. Also, an encounter with a physician in those days rarely benefited the patient. And also medical advice was usually the last resort before death. So I believe this is 1840s, right around 1840s. In the late 1800s, the idea of antisepsis was taking hold in Europe. Joseph Lister moved medicine forward from quackery to actual bioscience with understanding how to prevent bacterial contamination. And in the left picture, you can see white smocks appearing on physicians and assistants and paintings in the operating room theater. This again is in the Massachusetts General Hospital in about 1889. And this kind of suggests more of a cleanliness to the operating room environment. At the beginning of the 20th century, medicine truly became a scientific enterprise. The whiteness and pureness became reflected in the garb of both physicians and nurses. Medicine progressed throughout the 20th century. The white coat also became a symbolism of medical authority and respect. In fact, the image of a white coat has also become very intimidating to patients. There's a syndrome name for that, and that's called the white coat syndrome. A white coat syndrome is known for an unusual increase in blood pressure in usually normotensive patients and upon seeing a white coat. So there's always not a benefit to wearing a white coat, but does have other symbolisms other than that. Pediatricians and psychiatrists have generally chosen not to wear a white coat. Do you wear a white coat? No. In order to reduce anxiety amongst their patients. When I was in medical school, and now you know, whenever I was in medical school, a white coat ceremony did not exist. The white coat ceremony originated at the University of Chicago's Pritzker School of Medicine in 1989. And the white coat ceremony of today evolved from a vision of Dr. Arnold Gold. He was a professor of clinical neurology and clinical pediatrics at Columbia University in New York. He incorporated the Hippocratic Oath into the white coat ceremony. Traditionally, the Hippocratic Oath was taken at the end of your medical school training. But he believed that it's best for the students to have well-defined guidelines regarding expectations and responsibilities appropriate for their profession prior to beginning their training. So both the white coat ceremony and the oath symbolize a rite of passage into medical training. Due to the fact that students now begin meeting patients early in their education, the white coat ceremony is often done prior to your clinical rotations and very early on in your first year of training. The white coat ceremony has been embraced very widely. And in fact, over 97% of medical schools in the US and Canada, as well as medical schools in 13 other countries, optometry, audiology, dental, chiropractic, on and on, occupational therapy, physical therapy, pharmacy, physician's assistants, anesthesiologist assistants, even veterinary medical schools all mark this transition into clinical practice with the white coat ceremony. The white coat of a student is traditionally short during their training, and the long coat is usually of a practicing practitioner. The white coat symbolizes professionalism, caring, and trust. It reminds the practitioner of the relationship between them and their patients, and it should be serious and respectful and purposeful. Your white coat symbolizes to the world your dedication to patient care. So wear your white coat with pride and integrity. Thank you.
Thank you so much, Dr. Connolly, for that history on the white coat ceremony. I'm thrilled to announce our next speaker, our keynote speaker for today, Brittany Thomas. Brittany is an MSA program guest lecturer and serves as the lead CAA at Aurora St. Luke's, West Dallas, and 84th Street Surgery Centers. Among her many duties as lead CAA, Brittany also serves as our main student rotation coordinator at those sites, where she works tirelessly to provide a high-quality educational experience for our student rotators. She is truly an advocate for the CAA profession, for our students, and for our program. And I'm very pleased to welcome her to the podium. Brittany, you are invited to the podium.
Well, good afternoon. He kindly introduced me. I'm Brittany, one of the CAAs here, mostly at St. Luke's. So I will hopefully see some of you guys when you guys come through. And speaking of, I will also see you guys next Tuesday for our ABG lecture and oximetry lecture. So all of your pretty faces going to be on camera on the Zoom call. Yeah, great. Good to see you. But let's get to why we're all here. I won't keep you for too long, because I know you are very, very excited about receiving your white coats. You have worked very, very hard to get here. And this moment will be either very exciting or nerve-wracking, depending on the person. In this moment, all the years you have dedicated to job shadowing, volunteering, and studying literally everything, from MCAT to GRE and every exam in between, has led you to finally receive an acceptance letter from your AA school. Now, in that moment, you're ecstatic. You were nervous, but overall, it was very, very exciting, right? And then you go and you tell your friends and family, I'm going to be in AA. I'm going to AA school. And usually the first response they give is, what is an AA? Like, what is that? For me, I will admit, the most common question I got was Alcohol Anonymous, dead serious, as if you sign up for that, right? I was very confused by that concept. But once I tried to explain it the best way I knew how, some got it, some didn't. And then I started on my journey. So now you're here, right? You figured out housing. You got all the million books you needed. And then you started classes. And you asked yourself, what in God's name did I sign up for? Like, what is this? No, seriously, your first couple months, like, what is this? Understand that AA school is called organized chaos. No one going through it understands it. Only the people who are organizing it and managing the process makes sense. So now you're a few weeks and months into this, and you're starting to realize what it means to know nothing. You attend lectures, you read books, you study alone, you study in groups, and you acknowledge at this point 1 + 1 does not equal 2 anymore. You are beyond exhausted, you are very tired, and you study endlessly. You try to tell your friends and family your experience, but no one really understands. Instead, they come back to you telling you about things that are happening in the world, as if you have time to know that. And I know when I was to school, I told everyone, if it's not in Basics of Anesthesia, if it's not in M&M, I don't know it. And that was literally how I lived for 2 years. At this point, you are understanding that. You are now seeing how hard it is and how much you've actually worked to get to this point. Now understand, the white coat is a symbol. For some, it means you're a healer. It means hope. It means someone who can help them. But understand, not everyone feels this way. For some, it might mean hurt. It might mean pain. It might be someone who did not listen to them or listen to their family member and they have since passed. Both things will be reflected when you wear your coat. With this coat and this symbol, you and your life have to be reflective according to the symbol, regardless if you have it on or not. You know how well, I'm sure you will know how it feels to put on your scrubs the first day. You know, you set the scope, you guys have a lot of pens and notebooks and pads. You will have a lot of those. You might have a pager, you have all these things, and you're gonna put your white coat on. You're gonna go to clinicals. And anyone close to you or from afar, they will be able to acknowledge, wow, that person worked really, really hard to get to where they are. You also want to make everyone feel that way, even if you don't have it on. Even when you're just studying, when you're meeting your first patient for the first time, when you're finally working in the OR, you have to represent all the love, care, and dedication the white coat is to represent. During this journey, you're going to have a lot of tools to be successful. You're going to have lectures, labs, clinicals, so many study sessions, several presentations, board reviews, and these are just a few of the pieces that will make becoming an AA possible. The white coat is one of those tools. Make sure this tool gives you confidence, but most importantly, make sure it humbles you. My white coat ceremony was held at the end of my first year. I did not attend my white coat ceremony because the day after, I was on Friday, was my last day as a first year. On Saturday, they shipped me off to Ohio to start cardiac. Literally, so Friday I was a first year. Monday I was doing open heart surgery at 6 a.m. Can you believe that? Can you guys even envision that? Because I didn't. I was very upset, and I told my program director so. I was very vocal. But so for one, I was very nervous. I was scared, but also I didn't want to miss my ceremony. And he actually stated, the white coat ceremony is very nice. It's very fun, but what really matters is you'll get your white coat. And I, on the other hand, was like, no, I want the ceremony. I want the pictures. I want the food. I want the whole thing. Because in my mind, I worked very, very hard to have this moment, to celebrate. He said, no, you worked hard to learn cardiac. You worked hard to learn peds and neuro and OB. You worked hard to become the best clinician you can be for your patients. And to be honest, he was right. He's 100% right. I put a little bit too much pop and stance on what I thought being a healthcare provider was. And I kind of felt like I deserved the glory, if you will, of having a white coat ceremony. I can kind of relate how I was feeling to this. When first-time parents, they have their first baby and they turn 1. And they tend to have a really large birthday party for a 1-year-old, right? Overall, the 1-year-old doesn't really know what's going on, but the parent is very excited. That's called a survival party, okay? They survived the first year. The kids survived the first year. Everyone is happy for survival. That is essentially how I felt my white coat ceremony was for me. I survived my first year. But he was right. The ceremony, the white coat, was not everything medicine had to offer. I had to represent medicine from a personal level. When I walked through the hallways, regardless of my title or if someone knew who I was or what I was not, I have to make sure their experience was amazing. Same when I'm out in the world. When someone has a question, I should be able to help guide them unbiasedly and help restore the trust in our healthcare system in our country. That is what I represent. That is what the white coat represents. So the coat is just one of the tools. Make sure you're using your tools for good. Now, as everyone is aware, hence the reason the crowd is so small, COVID has been a whirlwind for healthcare employees. Honestly, it has been chaotic for the entire world. You see everything, especially social media, like check on your healthcare friends, make sure they're okay. But if there's anything I can say, I would say the white coat represents the journey through COVID. Let me explain. Providers have been moved to different parts, departments in other hospitals, or just different hospitals altogether. working different shifts with brand new coworkers and systems. Nurses, at least I can speak on behalf of Aurora, nurses had to be moved to warehouses just to make sure supplies and equipment we need was still being processed and brought to the hospitals. Anesthesia providers were working in ICUs alongside the ICU physicians, along with emergency care doctors. And everyone was just doing what we could. And everyone was doing what we could, fighting a battle with no end in sight and not even knowing exactly who our opponent was. All we knew was that we come to work and we kept fighting. We don't give up, we don't cower, and we fight full force. We were also understanding that we were humbled and we did not know everything. And we have to be okay with working, depending, and relying on each other, checking up on each other, and being open to give and receive suggestions. Being okay with going in the corner and crying, which I will admit I did several times, and understanding that that does not make us weak. It does not make us less than. That made us human. That is your white coat. This is the coat you will get today. Wear it with pride. You and your village have worked so hard to get here. Many of us have been working towards healthcare probably since elementary or middle school. Then you kind of got really serious and hunkered down around 9th grade. So we've been going nonstop since the age of 14. And now you're here today, understanding you have about 2 more years and then you'll be done, only to embark on a lifelong journey of learning. Remain confident and supportive. Have each other's back. Be okay with not knowing, and just be okay with saying, can you help me? To this day, I still do that, even with my anesthetists, the ones who just graduated this past year. I still ask them, can you help me with something? There's no pride in medicine. I graduated from KCDC in 2016. I moved here in September of that same year. I became the chief anesthetist at Luke's in 2018. Since then, we've hired over 20 anesthetists. We expanded over 3 locations, and we've started a really good student program, and we're very, very closely with you guys. Luckily, we've also been able to still and hire several of you guys each year. Speaking of, last year, 3 of the graduates came and started working with us. They have been working for 2 weeks before we had to pull them into the ICUs. 2 weeks. So, just 2 weeks after the OR, I was asking them to go into the ICU in a total different hospital. I had no specifics to give them, or really anyone on my team. I didn't know logistics. I had to figure out credentialing, literally nothing except you have to work 12-hour shifts in a brand new hospital with people we've never met. That's all I had for them. 2 weeks after they started in the OR. As you know, and everyone listening, we are trained to induce and care for our patients in a more controlled environment. We induce with our attendings present always. All of that training, and then I tell them, whenever you see your patient starting to go south, you have to hurry up and gown up, run in there by yourself, and intubate someone by yourself. 2 weeks. That is how well you guys will be trained in this program. I am so proud of my team, so immensely proud. There's no words to explain how proud I am during that moment. The courage and steadfastness was unmatched and unparalleled. I actually received text messages, even from the newbies, volunteering to go into the ICU rooms with COVID positive patients, and also protecting their other coworkers who were at risk or had someone at home at risk to make sure they didn't have to be as exposed. They were humble. They had very humbled resilience, a humble care, and a humble love for their patients. And more importantly, they were okay with supporting each other. Today, each of you will be getting this same white coat. You will be a family. You will support each other and have each other's back. We will all have your back. Your faculty, your friends, your family, all your future preceptors and lecturers. All we ask is that you don't give up. Stay strong, stay confident, but most importantly, stay humble. This profession will humble you whether you like it or not. The moment you think you grasp the concept, there will be a patient that comes by and shows you otherwise. I am a new anesthetist. I've only been out for 5 years, and I am humbled on a weekly basis. When you wear your white coat, make it a coat for good. Make it a coat for care, for compassion, and for listening. Make sure you meet each of your patients exactly where they are and treat and care for them exactly where they are. Okay, so that was a lot, okay? And I'm going to kind of wrap this up by saying this. We are all here for you. All your classmates, future preceptors, and every single person on faculty at MCW. They're here to make you better, wiser, and more awesome. So today you wear this white coat with a smile. You allow this moment to really wash over you. All the nights studying and all the sacrificing led to this moment right here. And today you celebrate. But tomorrow, when you wear your white coat, let it be what pushes and motivates you through the rest of schooling, through boards, and all the way into your first job, hopefully with me. Congratulations. We are so proud of you. Keep pushing.
I don't know how to follow that. Thank you so much, Brittany. So now we're going to go and get started on the actual coding. Is everybody ready? Everybody excited? All right. Don't sound very excited, but hey, we'll get there, right? All right, so let me go ahead and. All right, so it is MSA program tradition that members of the second year class welcome the first year class to the program by adding a gold MCW pin to their coat. I would like to now invite Mackenzie Reed, Vice President of the Class of 2022 Student Government Association, to the floor and take your mark right there. I would then like to invite Assistant Program Director Kyle Goem to the floor to coat our first group of students. Will the first row of students please stand and make your way to the marks here? In addition to coding and pinning our students, we are inviting our students to first step to this microphone to offer a thank you to anyone who has helped them or supported them in their journey to the program. Mike Saranowski.
Thank everybody for coming out today. So above all, I think I need to thank my wife and our girls who had to do a lot more around the house while I was doing prerequisites and the GRE and all of my applications. And then for finally coming to the understanding of what it would mean to be 1,000 miles away at school. I have countless coworkers who supported me by switching shifts whenever I needed, my education taken care of. And of course, I'd like to thank the selection committee for giving me the opportunity to come here. So thank you all.
Okay, thank you. Samiha Fatayr.
Hello. I would like to thank everyone who supported me from day one, the admission faculty as well, my friends and family, my fiance, David, and most importantly, my parents. I know you did not have the luxury of going to college like I had in the US. You also immigrated from a very far country to make me have my American dream, and I'm literally doing it right now. I hope I make you proud, and I hope I serve everyone justice. Thank you.
Kara File.
I would like to thank my family and friends, especially my parents and my husband. I wouldn't be here without all of their support. Thank you.
Marie Gurness.
I have quite a few people to thank. I have such a great support system. First, I would like to thank my husband, Caleb, for supporting me throughout this dream of becoming an AA and just being so patient with me going through this program. My parents for allowing me to come to the United States and study abroad. My host family, Holland, Greg Jacobs, for guiding me through from day one in the United States when I wasn't able to speak in English to this point where I'm able to study in a foreign language, and my in-laws, Amy and Dan for just supporting me through all my hard times and always being there for me. Thank you.
Emily Haft.
Hi. First, I would like to begin by thanking my mom and dad for always believing in me, for loving and supporting me my entire life, and for teaching me how to have courage and how to be kind. You are my absolute role models of how to live a life of love. I also want to thank Tom and Lynn for their love and support, their constant encouragement, their Friday night dinners that are always so delicious. Thank you for feeding me. And for their willingness to help in any situation. I want to thank the faculty and staff for selecting me for this program. It's been amazing. It has been a lot of hard work, but it's been amazing. And a special thanks go out to my husband, Peter, and my daughter, Poppy. They are my light, my love, my world. They bring me joy every day, and they make me laugh every day. I'm standing right here because of their support, their encouragement, their patience, their loyalty, their love. And honestly, it does take a lot of hard work to be here, but I wouldn't be here without the shoulders that I stand on, the amazing support from everyone who I listed, and all of those who I didn't have time to list. I only had one postcard thingy. But you guys know who you are, who I didn't get to mention. Thank you, and I love you.
Yeah, you guys have been. Oh, I had to sit down a second. Let's give a round of applause for Kyle and Mackenzie. You may take your seats. I would now like to invite Kyle Farmer, treasurer of the class of 2022 Student Government Association, and Amanda Esposito, MSA faculty instructor, to the floor. Will the next group of students start making their way to the marks? Britton Keene.
That last speech was so good. I could just say same. But I wanted to thank my kids, Gavin and Sailor, my husband, Joe, and everybody in my family who's helped put the pieces together to make this work. Also, the people that I worked with at Freighter, switching shifts, like Mike said, it was such a huge help to have a community of people help me get to where I needed to be. And cardiac trifecta, Dr. Betcher, Freed, and Plombeck, who believed in me. And my classmates also. Thank you.
Kara Coleman.
I'd like to give a quick thank you to my mom and my dad, my family and friends, and my boyfriend for all of their support through my long and hard journey to get here and reach my goal of becoming a part of this program and becoming an AA. I really wouldn't be here without all of their love and support.
Marina Matson.
Hi, everyone. I really wanted to thank all my family and friends, especially my grandparents, my Uncle John, my dad, my brother, and most of all, my son, for bearing with me and eating apples and books together almost every night for pretty much his whole life. But I just want to thank everyone for all their support and believing in me and being alongside me in this fantastic journey, especially my classmates and faculty, too.
Ariana Opsel.
Hello. I want to give a special thanks to my two biggest believers, my parents. You have made me feel fully capable of accomplishing anything and everything I set my mind and heart to. I want to thank my two biggest inspirations, my little brother Price and my sister Kaylee. You motivate me to be my best self every day. And I want to give another thanks to my biggest supporter, my husband, Jeff. You have been incredibly patient as I navigate this new experience. And I can't thank you enough for it. I love you all.
Rebecca Patel.
First and foremost, I want to thank my parents. Thank you for the values you have instilled in me, especially perseverance. I am who I am today because of your effort, guidance, and support. Thank you for always believing in me. I owe my success to you. Another huge thanks to my husband. You have always supported and encouraged me to follow my dreams. Thank you for being my emotional support throughout this entire process and for continuing to cheer me on and believing in me even when I feel like giving up. I wouldn't be here without you. Thank you.
Adam Poquette.
I'd like to really first thank my parents, of course, for making this possible. I'd also like to thank the military for giving me the opportunity when I was in the U.S. Navy, giving me more medical experience than I could have ever imagined. And then also for Aurora Sinai that introduced me to the AA profession while I worked there as a surgical tech. And then finally, I'd be super remiss if I didn't mention my wife. She actually ironed my clothes today. So to say that she's carrying me through is an understatement. She's a PA, so she's the first person I run to every time I have a medical question. She's carried me so far. So thank you so much for all that you've done.
Let's hear a round of applause for Amanda and Kyle. You may now take your seats. I now invite Michaela Ehlert, Secretary of the Class of 2022 SGA, and Nicole Bauer, MSA Faculty Instructor, to the floor for the final 6 students. 5 students. Sophia Schleppenbach.
First, I'd like to thank my parents for encouraging me to be patient until I found something that I knew I was absolutely going to love and encouraging me to go after the career that I fell in love with. I'd like to thank my sister for being in healthcare and showing me what it's like to be a true caring healthcare provider and someone that does what they do as well as they can. And last, I'd like to thank my boyfriend for going on this journey with me and encouraging me the whole entire way.
Sophia Shields.
I would like to thank my family for showing me what it looks like to work hard for what you want in life, and for also just reminding me that I can do this and deserve to do this. I want to thank my nephew specifically for being the light in my life throughout this stressful time. And I also want to thank my family and my boyfriend for emotionally going through this program with me and supporting me through the whole thing. Thank you.
Michaela Villaire.
Hi, I want to thank my husband, family, and friends, and everyone who got me here and for the opportunity to be here. Thank you.
Natasha Vovis.
Hi, I, again, just like everyone else in my class, love to thank my family for supporting me since I was really young, wanting to be a healthcare professional and guiding me through this. And I'd like to thank my friends for giving me good times and everything, and my boyfriend for, again, emotional support, and my family. And also, lastly, thank you to MCW for allowing us to have such an amazing future career and education. I'm really proud to be part of this program. Thank you.
Let's give another round of applause for Nicole and Michaela. Wow. Now that you are all coded and look the part, let's keep the tradition going and recite the anesthesiologist assistant oath. I now invite Jen Barker, Children's Hospital of Wisconsin Chief CAA, to the microphone to lead our class of 2023 in the oath.
Hello, everyone. I'd like to invite the students to please stand. Raise your right hand, please, and repeat after me. I hereby solemnly swear in the presence of all assembled today to carry out to the best of my abilities the following oath. I will strive to reduce the suffering of my patients at all times. And never will I use my skills to knowingly cause injury or for any wrongdoing. I will treat each patient with equal energy and respect his or her diversity, while safeguarding their privacy and honoring their right of autonomy. I will work to be an exemplary ambassador of the anesthesiologist assistant profession. And will always work to strengthen its place in the healthcare team. Congratulations. You may be seated.
All right, thank you. You may be seated. Thank you, Jen, for that wonderful rendition of the oath. I now ask Dr. Michael Stout back to the podium. Professor Stout.
Gotta say, hearing you guys at the microphone, I am speechless. I'm exceedingly moved by how well you recognize that it's been a village that got you here. I want you to think about your career the same way, that we are a community. We need each other. And while sometimes it can feel lonely, everywhere you turn is someone that's willing to help you. Thank you very much, Brittany, for sharing your experiences in a way that they're living it. Thank you, Dr. Kirshner, for welcoming these students to such a prestigious institution with the opportunity to experience medical education, healthcare learning in an interprofessional way. Dr. Lang, thank you so much for welcoming them into their future alumni association, knowing, as I said, the cradle to grave interconnectedness that we will all share. I am in your honor. The class of 2022, you leaders are resuming our tradition of passing the baton, but no one passed it to you. So I'd like all of our class of 2022 students to please stand up, and let's give them a round of applause as well. Thank you. Thank you. You picked up where we left off. You're following in footsteps that weren't shown to you directly, but have always been there. I'm proud to be your faculty. I'm proud that your faculty will stand by your side. I'm proud that your administration is here to support you. And I look forward to seeing you in the operating room. Thank you.
Thank you all so much for being here. As each of us shared, it is an honor to be here. We're very happy to even host this event this year. On behalf of the MSA program staff, I would also like to thank the MSA program staff, Emma Momich, Anna Dixon, for helping put this event together today. And lastly, I want to give a huge thanks to all of you watching the live stream. Your participation here, your presence, because of all the thank yous, because of the warm and fuzzy feelings we've been having, is really felt. And so thank you for participating. Thank you all for being here. And that concludes the white coat ceremony for the class of 2023.